closing comments, we've got Umair Shah. You guys have seen him before. Secretary of Health of Washington's State Department of Health, and Brandon Talley, my boss, Vice President of Non-Infectious Disease at the CDC Foundation. So I think, are you going first?
Well, we made it. 2 days. Congratulations, everybody. Thank you for being here. I haven't formally introduced myself. I'm Brandon Talley. I'm the Vice President for Non-Infectious Disease Programs at the CDC Foundation. In that role, I have the privilege of working alongside a great team focused on data modernization, which is how I connect to the work that's been happening the last 2 days. First, I'd like to start by thanking you for attending the Washington Data Health Innovation Summit these last 2 days. On behalf of the CDC Foundation, I'd also like to start with a heartfelt thank you to Dr. Shah, Dr. Karas, the summit participants, and the Washington community for so generously hosting and contributing wisdom and insights to this summit. We have seen a glimpse of how rich perspective, coupled with dedication to a public health mission, have sparked innovations in health information systems right here in the Pacific Northwest. We began today with reflections, and I'd like to leave us with a few more that help frame not only the summit, but also the ongoing commitment to transforming health data. Dr. Shah reminded us, data transformation requires creating a bridge for people, policy, and technology. And right now, we're undergoing a paradigm shift in how public health and how we do public health. This paradigm shift has been apparent for some time in industry, but has not yet seeped into public health. Lessons from industry partners like Microsoft, Amazon, and others demonstrate the world of possibilities when it comes to better, real-time, practically meaningful data. Yet, data modernization is not solely dependent on or enabled by technology. Technology is necessary, but not sufficient for transformation, and real change needs trust, equity, and community at its heart. The CDC Foundation is committed to finding innovative health data solutions that can scale in ways that traditional methods have not. CDC, too, is committed to transparency, engagement, and accessibility on its innovation journey. Innovations often begin as new, sometimes scary, and sometimes implausible ideas. Washington recognized this and responded with an innovation incubator program known as Spark Tank, which you heard about yesterday. This program helped to identify a new value proposition. For a relatively small investment, pollen surveillance could be revolutionized, potentially helping many pollen allergy sufferers better manage symptoms and related health issues. Such an example shows how aspirations translate into real-world, real-time solutions, solutions that can serve as a model for data revolution in service to the public's health. Exposure notification technology, which represented a different paradigm for public health surveillance, offers another example. Despite initial resistance and reluctance, the technology was quickly adopted by a nationwide network during COVID-19, and there is evidence to suggest that in Washington, the WaNotify app averted over 5,000 cases in the first 4 months of the pandemic, and perhaps 50,000 cases throughout the course of the pandemic. We are fortunate to be on this health data journey with an extraordinary group of partners. We hope to broaden that coalition, assuring that public health and non-traditional public health partners alike actively participate in designing and implementing equitable health data systems for the future. Bringing together multiple organizations for this event took a talented and dedicated team, and I'd like to thank again sorry, there's a net flying around me. I would like to thank our Washington partners and the CDC, ONC, CDC Foundation teams who worked tirelessly together to organize this event. I would also like to thank the staff here at the Graduate and the Federal Business Council team who managed coordination and support throughout the last 2 days, actually well before the 2 days. Thank you to the presenters who inspired and stimulated our thinking, and thank you to the attendees who have started the conversations to accelerate data modernization for public health. We look forward to continuing our momentum and conversations and establishing meaningful partnerships on the go forward. Dr. Shaw, you started us off 2 days ago with a focus on EIE, equity, innovation, and engagement. As we leave here today, let's challenge ourselves to embrace those values. And if I might be bold in the spirit of audacious goals, I'd like to propose a friendly amendment, a second set of EIEs: energy, intention, and everyone. We'll need both sets of these EIEs to transform health data in our communities and the world. And finally, Dr. Karras, thank you for coordinating the Brooke Museum visit this afternoon. They're offering us a great discount, not 15%, 50% with your badge. And a walk through that living history of the region provides a unique moment to embrace a deeper understanding of the diverse communities in Washington. It also can inspire us to take lessons and partnerships from the last 2 days back home with us. I hope everyone has a safe journey home. Thank you for your time, your energy, and your insights the last 2 days. Stay well, and we look forward to our journey together. Dr. Shaw.
Thank you, Brandon. Appreciate the kind words, and also for your partnership and being here. And I think that really has been what this has been all about. It's about partnership. It's about having people in the room. And by the way, you're all the last folks, like the standing folks, or seated folks that had made it to the very end of this. So please give yourselves a round of applause. I mean, this is amazing. I'm impressed. I'm impressed. So I'm gonna bring it home. I do want to say a few things that I learned, and I love the new reframing of EIE. So thank you, Brandon. I think we're going to change a lot of folders, and so now you've got a lot of folks that are really concerned at our agency that we're about to change. We're not, but I really appreciate that. I want to say a few things, but first I want to start by some acknowledgments and some gratitude for folks that really helped to bring this home. You heard from Brandon, so Brandon, thank you. Dr. Judy Monroe, her entire team with the CDC Foundation. I just can't say enough about the partnership. Joe Gibson, Robin Murtis. And by the way, I'm going to mention a lot of names, but I'm going to pronounce half of them incorrectly. It is just the best I can do because I have not had coffee. If anybody was at that very beginning session, you know exactly what I'm talking about. If you weren't, well, I'm sorry about that. There you go. Where's Brian? No, there, the gentleman in the orange. Yeah. We had just about 120 folks, and we could have, and I was talking to Judy about this, we could have really had 3 times the people in 3 times the size of a room, but we wanted to obviously have a meaningful conversation that was really everybody together. I want to thank, as I mentioned, the CDC Foundation. I also want to thank the CDC, ONC, DHS, Department of Homeland Security, Jennifer Layden, Susie Connor, Agnes Warner, Dylan George, Ryan Argentieri, and Tom Wilkinson. I want to thank so many of our private partners that were here: Apple, Google, Microsoft, AWS, Amazon, MITRE, AIRA, help me? ERA, thank you. The immunization, I know it's immunization, I can tell you that much. Some of these aren't private, so that's why I was starting to pause here. Amazon with Don Heisey Grove, Chris Silvers, Jim Daniel, Google, Javier Tordable. I tried to do that one correctly, but I don't know if I did that one. Parker Mills, Apple, Luke Winstrom, who, by the way, is going to take my Apple Health, my watch stuff, and he's going to try to share it with whoever developed it, and I'm like a big fan, so just wanted to let everybody know. Michael Tan, Microsoft, Sheridan Jones, Michael O'Hara, Heather Mitchell, Geraldine Miller. We had MITRE, as you know, Dr. Brian Anderson, Brian Martin. ASTHO was represented here with J.T. Lane, and also my colleague, who is Chief Medical Officer at the Alaska Department of Health and Human Services, Dr. Ann Zink, who's fantastic. I hope you enjoyed her presentation. CSTE, Council of State and Territorial Epidemiologists, with Angela Dunn, Megan Thompson. And I also wanted to thank University of Washington, Janet Baseman especially. Where's Janet? Somewhere. Janet, anywhere. Oh, she's not one of the... Okay, that's fine. Dean got... There you go. Dean Godwin, who she's meeting with. Okay, so they're both meeting together and not here. We will call them out on that. Dr. Kate Starbird on misinformation, Bill Lober and the team from UW as well. I want to recognize public health, local public health that was in the room. We had Luke Davies, I think, Chelan Douglas. Luke, I don't know if you had a chance, our director, fantastic director in Chelan Douglas County. Luke has been here throughout the 2 days. We also had Whatcom County, Tacoma Pierce County, Public Health, Seattle King County. Obviously, we had departments of health from Alaska, Utah, Montana, Idaho, Hawaii, and as we all know, our thoughts and prayers go out to our brothers and sisters and people from Hawaii, and so I hope you will continue to hold them close in your hearts, but also please contribute to try to help the people in Hawaii right now, Oregon and Canada. And I also want to recognize the Northwest Portland Area Indian Health Board, Heidi Lovejoy, as well as the Urban Indian Health Institute with my colleague and friend. Where is Abigail Echohawk? Where is Abigail? Is she here? Oh my gosh. What she said yesterday about community and the importance of community, the importance of not forgetting community, I think is something that none of us should forget. Department of Health, Les Becker, Liz Perez, Chris Holliday, Ian Painter, Rad Cunningham, Alyssa Miller, Ravi Kafle, Chris Baumgartner, Michael Campbell, Brian Karras, the gentleman in orange, Mike Ellsworth, Miranda Hay, Carrie Evans, Tony Castaneda, Cynthia Harry, Dr. Tao Kwan Get, and Lacey Fehrenbach, Claire Cutt, Steve Hong, Jonathan Castro, and a whole host of people behind the scenes, fellows, student volunteers, everyone else, FBC, David Powell. I think I got everybody on this list. Did I forget anybody in the room? Okay, good. All right. I've learned so much over the last 2 days, and I think this is such an incredible opportunity to continue this journey. We talked about public, private, academic, and community partnerships. We talked about EIE, both versions. We talked about silos of excellence and recognizing that we have to get beyond those silos. We talked about the importance of trust, the importance of transparency, the importance of communication, the importance of intentionality, the importance of we and the team, the importance of working in emergencies, but also Blue Sky Day. We talked about the importance of transformation, that we can't do it the same ways that we have done it before, that we must come together in health and tech, but we need to come together for the betterment of community and people. Investment, intentionality, as I mentioned, sustainability of that investment and intentionality. The workforce, the challenged workforce that right now is having so much concern from all of us about their ability to continue to hang on as we come with reinforcements of more people or more technology. We have to do this with urgency. We can't just keep talking. We must have action. So I hope you will continue to move forward in that direction. I love the concept of tech forward that was just mentioned in the previous session by some of our private partners, that we want agencies and partners in the public sector that are tech forward. But we also want to be thinking about how can we be health forward from our technology partners as well. I'm struck by this concept of, I just made this up, so I apologize for that. RIA, respirations, inspirations, aspirations. We don't want to just be stuck in respirations. That's what we do all the time. Take a breath right now, and I bet you're taking 12 to 16 breaths a minute, unless you're, hyperventilating or there's something wrong. 12 to 16 breaths a minute. So just take a moment and think about your respiration. It's an incredible sense of being. That's the minimum that we need as human beings, is to be respiring, respirations, breath. We need to get to different levels. We need to inspire, but we need to also aspire. aspirations for what we're trying to achieve. And we can't do that alone. We have to do it together. That's what the last 2 days have been about. I want to thank Microsoft Research and AWS also for allowing us the ability to see them on ground 2 days ago. I want to thank all of you for being here. And another concept that was shared was that this journey is about shared risk and also shared benefit. When we are willing to risk together, we're also willing and will benefit from shared benefit and opportunities together. I can't say enough about all of you being here. Thank you so much for 2 days. The journey has just started. Is that right, Brandon? This is not the end of a conversation. How many in this room found the last 2 days valuable in some way? How many did not? All right, I put my hand down too. Okay, I was trying to be provocative to give some solidarity to the one person who said this was the worst thing in the world. And I think when we look at all this, ultimately, this is the journey forward. But we can't stop where we started. We must continue to move forward. Our communities expect it. Our friends and neighbors expect it. All of us expect it. And we have to be thinking about trust and transparency. So, if I can just say one last closed message, which is we have a lot of steps ahead of us, but we have started that journey. And if you take it from a different metaphor, there are swim lanes that all of us have. There are some people that are swimming really fast. There's a lane that's like Olympic type of, really swimming, and they're going really fast. They believe in public, private, academic, and community partnerships. There are some that are in the pool, and they're kind of swimming, and they're going pretty well. They're not Olympic level, but they're going. There are others that are in a pool, and they're kind of splashing around. They're thinking, water's kind of cool. There are others that are actually trying to figure out, should they put their toe or their feet or their foot in the water in the first place? And there are others who think, is there even a pool here? I'm going to ask all of you to be thinking about, how do we inspire, how do we aspire and get beyond respirations to really help those that are not in the room or not a part of this journey to recognize that there is a pool and we need to get into the water. So with that, thank you so much. I want to close by saying, Abigail, you were out of the room when I mentioned you by name. And I just want to thank you for bringing home the message yesterday and continuing throughout. You are my friend. You are my colleague. You're somebody that inspires me. And so thank you so much for just making sure that you reminded us of the importance of the work that we're doing and why we're doing it. So with that, closing out, we changed the weather patterns for all of you. I know the folks from out of town were thinking, this is Seattle, this is Washington, it's hot. No, we changed the weather pattern. So now today it's dropped about 10 degrees. We're now back to summer how it usually is in our state. And with that, I'm going to say thank you so much to all of you. Dr. Brian Karras, please stand up. Les Becker, please stand up. Thank you to both of you and your teams for inspiring us. Particularly, thank you for reminding us that we have to have safety first. So, Dr. Karras has the orange vest on. He is going to be the escort to the Burke Museum for those who can stick around. Thank you so much. Have a great weekend. Safe travels back home.